Dr. Matt Samore is a self-proclaimed data geek, but with a purpose: to change the way we prescribe antibiotics.
What are veterans diagnosed with, and how are those diagnoses treated? And is it justified? Is it high quality care?
Too much of a good thing leads to antibiotic resistance and further infections. So Dr. Samore and a team of other researchers developed a plan.
So the pilot consists of developing what we call dashboards, ways to measure, and then to provide those measurements to clinicians and work with clinical champions, and to give people feedback about their prescribing. When we meet with people, we meet with clinicians, and we talk about when are antibiotics appropriate? What are the appropriate choices of antibiotics?
Treatment of the common cold is a good example.
One of the biggest areas of overuse of antibiotics is treatment of colds and sore throats and coughs. These viral infections are not treated with antibiotics. Antibiotics do not help. Other symptomatic medications help. People get better on their own.
To drive improvement, providers across VA need access to data sources so they can see beyond their own practice and prescribe more effectively.
So we went from being a system that where each VA did their own thing independently to a system where there was coordinated efforts across all the VA hospitals.
Dr. Karen Gribben is the Chief of Staff for the VA Salt Lake City healthcare system. She's seen the impact of Samore's work.
Matt has not only done amazing work himself in the fields of epidemiology and infectious disease, antimicrobial stewardship, but he has mentored the next generation of researchers who are just going to continue to build on this, on what Matt started.
Dr. Samore is considered one of the top researchers in the world in the use of electronic record data to improve prescribing practices and affect patient outcomes. Yet he's a bit humble when it comes to awards like this.
You have to give people tools to understand their own practice. When you're taking care of one veteran at a time, it's hard to see the big picture. You need someone to help you understand how your practice compares to someone else. We don't get into this business to get awards. That's not why we do this work. We do this work because it's satisfying, because it's meaningful, because it's purposeful. So yes, it's wonderful to be recognized. It does feel rewarding. It's personally gratifying. I was happy to tell my family. I was proud. I wish my parents were alive. I wish I could tell them, and I know they would be very happy. That was my reaction.